and a very good morning to you. It is Rhema Brekky, and it is the month of November. Another big one, health topic-wise. It is Pancreatic Cancer Awareness Month around the globe, and our special guest this morning, of course, is Dr. Clara Chu from Life Medical Centre over there at Erina. How you doing, Clara?
Yeah, doing really well. Thanks, Mick. Good to be back in the studio with you.
Absolutely. And again, like I said, this is another very big health topic. And as I mentioned earlier, Pancreatic Cancer Awareness Month. Now, before we jump into this, probably a really good idea to let our listeners know exactly what is the pancreas and what is its role in the body.
Yeah, so the pancreas is a very important organ that's located in the abdomen or the tummy. It sits behind the stomach and under the liver. So it's a thin, elongated organ, so about 15 centimeters long, and it has an important role in both digestion and blood sugar regulation. So it's made up of two main types of cells. So the first type is called exocrine cells, which means that they produce digestive enzymes. And then the second type of cells are endocrine cells, which means that they produce hormones. It has the two primary functions, which are essentially based on the type of cells that exist. So the first was the digestive role that we talked about, that's made by the first type of cells. And so that's where the pancreas produces and secretes digestive enzymes, and that helps to break down carbohydrates, proteins, and fats from the food so that nutrients can be absorbed by the body. So these enzymes include lipase, which breaks down fat, amylase, which breaks down carbohydrates, and then two other enzymes called trypsin and chymotrypsin, which breaks down proteins. So a fun fact is that the pancreas releases about 1 to 4 liters of enzyme-rich pancreatic juices every day.
Wow.
Yeah, that's a lot, right?
Yeah, for that size organ in the body.
Yeah, just one organ. Now, the second role is the blood sugar regulation. So this is also called the endocrine function. So the pancreas produces a hormone that regulates the blood sugar levels. So there's actually two. So the first one, most people know, that's insulin. It's produced by a type of cells in the pancreas called beta cells, and it lowers the blood sugar levels. The second hormone is glucagon, which is not as well known. That's produced by alpha cells, which raises the blood sugar levels. So you can see it's a bit of a balancing act that the pancreas does in terms of releasing insulin and releasing glucagon and helping us to maintain a good balance of the blood sugar levels. And so, the pancreas plays a really important role in hormone regulation, in digestion, and so, super important for metabolism and overall health.
Yeah, some great info there. I'm sure there's a lot of listeners probably just thought to themselves, I had no idea about the pancreas. I hardly ever hear about it, so there you go.
Yep.
Now, what exactly is pancreatic cancer?
So pancreatic cancer happens when cells in the pancreas grows uncontrollably and they form a lump or a tumor. Now, this may affect how the pancreas works, including the functioning of the pancreas. And so it can occur in any part of the pancreas, but about 70% of the pancreatic cancers are located in the head of the pancreas, which is the part that sits the closest to the small intestine. And so because the pancreas essentially sits right next to the small intestine, has a duct that allows it to release these digestive enzymes and things like that straight into the small intestine. So you can see that it's very closely attached. And the pancreatic cancer is often hard to detect early because it doesn't usually cause symptoms until it's very advanced.
Which is why you often get the, I guess some of the bad outcomes really with pancreatic, when you hear about pancreatic cancer than some other cancers. Now, what are the most common signs and symptoms of this?
Yeah, so look, the early stages of pancreatic cancer, as I said, rarely causes symptoms. And so usually we only find that the patient would come and see us as doctors when the cancer is large enough to affect other nearby organs. So this can include pain in the tummy, a loss of appetite, nausea and vomiting, weight loss, changes in their bowel habits, which can include diarrhea, constipation, or just a feeling of incomplete emptying. And a late-ish sign is jaundice, or having that yellowing in the skin or in the eyes, or a darker urine. Now, some less common signs that some people can get could be severe back pain. That's because the pancreas is kind of situated more towards the back of the tummy. And yeah, you've got to be suspicious when a much older person has new onset diabetes, because 10 to 20% of people with pancreatic cancer also develop diabetes.
Wow, interesting fact, that one for sure. Now, what are the causes and the risk factors associated with it?
So some of the risk factors that can increase your risk of pancreatic cancer include smoking. Increases the risk of, yep, that's right, increases the risk of pretty much everything. Yeah. Age, can't really solve that one. Most cases occur in adults over the age of 60. Diabetes,
right.
Particularly new diagnoses of diabetes, we kind of then become a bit suspicious, especially when the person's quite old.
Yep.
And what we're talking about is new diagnoses of type 1 diabetes, not type 2.
Sure.
Right? So we need to make that distinction. Type 2 diabetes is the one that we've talked about in the past, where it's more lifestyle driven. Type 1 diabetes is more to do with the actual cells in the pancreas not working.
Right.
If there's a family history of pancreatic, ovarian or colon cancer, there's a bit of a link there. Anyone who's got chronic pancreatitis. So pancreatitis is a condition where the pancreas becomes inflamed, and the causes of inflammation can be, excessive alcohol consumption, which is another risk factor for pancreatic cancer. But chronic pancreatitis can also happen for certain people who have been exposed to certain drugs maybe, or, certain other foods that just don't agree with them for whatever reason.
Yep.
And of course, obesity or being, grossly overweight, that can also be a cause of pancreatic cancer.
Sure. Now, how is it diagnosed?
Yeah, so look, as doctors, we can order a number of tests, which will generally include blood tests and imaging scans. Now, sometimes we will organise tissue sampling of the tumour as well. But yeah, let me explain the purpose of each one of these. So with blood tests, we organise them to check for general health, see how well your liver and kidneys are working. Some blood tests will look for proteins produced by cancer cells, so we call them tumour markers. And so many people with pancreatic cancer can have higher levels of two particular tumour markers in their blood. So on their own, they're not really specific enough to diagnose pancreatic cancer, but that's because some people with pancreatic cancer can have normal tumour markers. And conversely, there are other conditions that can raise the levels of these markers without someone having a cancer.
Sure.
So, it's kind of normal for these tumour markers to go up and down a little bit, but I guess what we're looking for is a sharp increase and the overall pattern. And also raised levels can tell us more about the cancer after the diagnosis and show us whether, the treatment is working or not. The next thing that we will sometimes order, or mostly, definitely need to order actually, is imaging scans. So they're very helpful if we're suspecting a pancreatic cancer. So that can include a CT scan. So a lot of people would know about CT scans. It's actually an X-ray beam, takes many pictures inside your body, and then the computer puts it all together into one detailed cross-sectional picture so that we get a sort of, a 2D image of what's going on. We can also do some other scans called endoscopic scans, which can show blockages or inflammation in the bile duct, in the stomach and in the duodenum. So they're all kind of like affected by the pancreas if there is like a tumour growing in there. So for these scans, what you will need is to have an endoscopy, which is where we've got the camera on end of a long snake. You're sedated and it goes in through your mouth and down your esophagus, your stomach. And that's where they can actually take a tissue or fluid sample to help with the diagnosis.
Sure.
And then finally, people can have like an MRI, which uses a powerful magnet and radio waves to create a detailed cross-sectional picture of the pancreas and other nearby organs. There's a second magnetic scan called MRCP, which is a massive mouthful here.
It's a big one.
Magnetic resonance cholangiopancreatography.
Well
Got
done.
that out. So it's a different type of MRI scan, and it produces a more detailed image that can be used to check for blockages and causing other upstream effects because of the blockage in the pancreas. We also have PET scans. And that's where, usually used by oncologists to basically look for spread of the pancreatic cancer and to see how well it's, responding to treatment. So they're all the different types of scans. Now, having said that, as a GP, mostly I would probably just order a CT scan. And once I get a diagnosis, I'm like, right, off you go see a specialist, because a lot of these things are very specialized. And as you can, tell from the description, you need specialized equipment and skills in order to be able to actually work out what's going on. And then finally is just tissue sampling of the tumour. So if the imaging scans show that there's a tumour in the pancreas, your doctor might remove a sample of cells or tissue from the tumour. This is also called biopsy. And so that's the main way to confirm if the tumour is a cancer and exactly what type of cancer it is. So they'll, a specialised doctor called pathologist will have a look at the sample under a microscope to look for signs of cancer. And then sometimes if the results aren't clear, we might need to do a second biopsy. And then, of course, we can also do a biopsy, under ultrasound or CT guidance, or sometimes during keyhole surgery or during the surgery itself to remove the tumour. We'll always send off samples of what's been removed from the body to basically confirm, what's there and what's been removed, and and get a proper tissue diagnosis of what's going on.
Sure. Yeah, look, it's a huge topic, this one, Pancreatic Cancer Awareness Month for November. We are joined in the studios this morning with our resident medico, Dr. Clara Chu from Life Medical Centre over there at Erina. We'll take a short break and we'll be back with Clara right after this. Welcome back. We are joined this morning at the breakfast show with our resident medico, Dr. Clara Chu from Life Medical Centre. And another big health topic this month, we're talking about Pancreatic Cancer Awareness Month for November. Now, Clara, what sort of treatments are available?
So treatment for pancreatic cancer may include surgery, endoscopic treatment. So again, where we talked about having the camera passing through your mouth and your esophagus and stomach. Chemotherapy or radiotherapy, or combination of these things. So look, if the cancer's been caught early, surgery is the most common treatment, and usually the operation that's performed is called the Whipple operation, and that's where they remove a part of the pancreas, the first part of the small bowel, so the duodenum, which sits right next to the pancreas, a part of the stomach and the gallbladder, and a part of the bile duct as well. So it's quite a
really
big
invasive
operation. There's quite a few organs that are affected and a few things that are removed. But the reason for doing that is because the pancreatic cancer has a tendency to just affect all those bits around it. And so unfortunately, this treatment will only be suitable for about 20% of people with pancreatic cancer, because most people are diagnosed at such a late stage that, in order to, sufficiently remove the cancer, it's just way too invasive, and it may not even be possible.
Yeah.
And then, for advanced pancreatic cancer, treatment's often there to relieve symptoms such as, pain and digestive problems. So it's a very different cancer to a lot of the other ones that we talked about, in that the treatment, the treatment options are not that many. Yeah.
So on that, what are some of the stats around pancreatic cancer?
Yeah, so it's surprisingly common. So it's the 8th most commonly diagnosed cancer in Australia. And it's estimated that 1 in 70 people will be diagnosed by the time they're 85.
Wow, I had no idea it was actually that type of number.
Yeah, it surprised me a bit as well. Obviously, in med school you study all these things. Things come in, things go out. But to, do the research again and just go, oh, wow, it's actually quite common. So the average age at diagnosis is 72 years old. So it's an older person's disease.
Yep.
And in Australia, it's estimated that 4,641 people will be diagnosed with pancreatic cancer this year. And that over 3,700 people will unfortunately die from it. So it's projected to be the 4th biggest cancer killer in the country. So not the most common, 4th most common, but the 4th biggest killer. Simply because it's always often picked up so late. And often because the treatment modalities for it, aren't as good as other cancers, which kind of diminishes its survival rate. So the 5-year survival rate for pancreatic cancer is actually only 12.5%, and only about 36.4% of patients survive 1 year after the diagnosis.
Yeah, they're not good stats, are they, for pancreatic
not at
cancer?
all.
So, and again, as you mentioned before, probably part of, or I guess a lot of the problem there is the late diagnosis. That's really what it is, isn't it?
Yeah, and it's not an easy cancer to pick up because, as I explained at the start, it's the organs kind of hidden deep inside your tummy.
Yep.
It's just one of those things that does not trigger off a lot of alarm bells. And again, it's a bit of a testimony to how resilient the body can be, that it can, hide something so sinister so well for such a long time, continue to maintain function for as long as possible before, there's some external signs that something's gone wrong.
Yeah, it's quite amazing. Now, if yourself or even a loved one may be diagnosed, what sort of support is out there?
So in Australia, there are a few pancreatic cancer support organisations. So the first one is the Australian Pancreatic Cancer Foundation, or PanKind for short, so PANKIND. So they support people impacted by pancreatic cancer by providing relevant information, valuable resources, and a connection to other people affected by the problem as well. So they have pancreatic cancer support groups in person, over the phone, or online via Zoom. So that would be a good resource for people.
Sure.
The second is an organisation called PanCare Foundations. So their work is in raising awareness, supporting families, and funding research for upper gastrointestinal cancer. So pancreatic cancer is one of them. Other upper GI cancers would be like esophageal cancer, stomach cancer, and those kind of things. So they have support groups and a helpline staffed by dedicated specialists in upper GI cancer care. And of course, there's always the Cancer Council, which has a lot of excellent resources.
Yeah, it sounds like definitely one of those types of cancer that we need to really be investing, I think, more time into, particularly with, early diagnosis, treatments, options, all that kind of thing, because some of those stats not really good when you look at it, and obviously we're living a lot longer than what we were years ago.
Yep.
So you're probably going to have a higher a higher incidence of this into the aging population, which is really unfortunate. So I guess getting more people involved in fundraising, getting governments more on board, more research and things would be helpful.
Yeah, and remembering that I mentioned earlier that there are some lifestyle factors that can, sort of reduce your chances of developing it as well. And that doesn't just apply to pancreatic cancer, it applies to all sorts of cancers too. So, just remembering, being healthy and active, eating well and all of those kind of things, and, making sure you don't smoke and making sure that, you're reducing your alcohol consumption, like all of those things, are little pieces of the puzzle that can actually help also. Yep,
absolutely. You can't say enough for, healthy lifestyle, that is for sure. Dr. Clara, as always, thank you so much for joining us this morning. This is Rhema Brekky. We'll take a break. Back after this.